You're watching TheMediTube.com, India's first doctor-to-doctor TV.
Can you use an interlocking nail as an direct mode of primary stabilization? This is still a very controversial aspect. There are many countries even in the West where they would not do it, but we have been doing it for the last many years. A good example is this. This is a type 1 grade 3B1 fracture. You can see that you've got this fracture anatomy is very good for interlocking. There is not too much debridement. All that you need to do is to extend the wound, clean it, and if you're sure of your debridement, then this patient had a primary nailing and a primary closure, and this went on to very well. Now, the actual length of the wound itself is not the primary criteria. The criteria is whether you are able to close the skin or do a flap immediately, and whether the debridement sufficiency is good enough for you to be assured of doing nailing. So again, you can see that this is a 3B injury, primarily nailed and quickly flapped, and this patient went on to a very good result. So there are really good indications where you will be able to do a primary nailing, and nail is one of the most friendly methods of fixation for a plastic surgical procedure, because the plastic surgeon then becomes almost free to do whatever you want. So the initial fear that a nail will devoid and remove the intramedullary blood flow and will actually hamper the fracture union has not been proved to be in clinical experience. In fact, in clinical experience, we found that they have a shorter healing time, easy wound access, early mobilization, and lower complication rates when your debridement has been very good and when your indications are very strict over here. In fact, the ultimate bone healing in terms of malalignment, non-union, and bone grafting, you can see they are highly favorable wherever you have used nails. So you can use it in in good this thing. The whole controversy of whether you should use reamed nails or unreamed nails has become a old controversy, and nowadays the favor is towards